So that was in response to the needs of the community. So that's something that we did before to the pandemic, and obviously we have plans to bring that back as soon as we're able to do so. And you know, hopefully when everybody's vaccinated and we no longer have to keep that distance, right? And then obviously, Pierre can share a little bit of the stuff that we have collaborated also with the Nevada Police Department, is our camp, Camp Kuga, which is a camp for children. We used to call it Camp Chance, so you might have heard that before, but we renamed it in honor of the Rebecca Kuga, who was our main facilitator of the camp, who recently passed away. So we call it Camp Kuga now. So in addition of the pillar, that's pillar number one, right? That's just building the trust with the people, right? Pillar number two is about policy and oversight. So we have to be responsive and transparent in our process of setting policies and developing, you know, our policing policies. Obviously, like I was telling you, we listen on these different events and we can tailor our approach to what it's best to serve our specific community. There's over 18,000 police agencies in the United States, and you know what works in other places may not work here in Marin County or even here in San Rafael. So, and what we do here in San Rafael might not be appropriate for other states or other jurisdictions. So I think it's important to acknowledge that and keep that in mind for some of you that may not be too familiar with law enforcement. There are 18,000 different law enforcement agencies out there. So that's pillar number two. Pillar number three talks about technology and social media. And that's just being able to communicate very promptly with people, with the community, using social media. So I'm the Twitter sergeant, so I'm constantly updating different things and putting out some information, and we use that provide real-time information to people out there. If you live in the city of San Rafael, I encourage you to sign up for Nix alerts and also for Nextdoor, so you can get immediate real-time information. So, you know, that's in addition to the traditional social media sites like Facebook and Instagram and Twitter. Although we don't have a TikTok account, so some youngsters were asking me about, hey, when are you guys gonna have a TikTok account? And let's face it, I don't think I'm gonna be doing any dancing videos, but so I think no TikTok for now, but we'll see. And then the pillar number 4 is community policing and crime reduction. And that is, you know, again, it's collaborating with different partners and community institutions to increase public safety. And this is where Todd's mobile crisis unit comes in. And I'll let him speak more about that. But I became a cop in 1999 here in Marin County. And we had some training in the academy, and we had some additional training by our field training officers. And then we were supposed to respond to people in crisis, people that are having some mental health issues. And, you know, I just had, from my personal experience, I just had just very few training and dealings with people that were in crisis. So, you know, I'm definitely glad that we have evolved, and now we're partnering with, you know, community organizations like Marine Health and Human Services and Mobile Crisis to provide these services. You know, some of the things that nationwide happens is that if somebody's in crisis, they'll call 911, and what response do they get? They usually get a guy with a gun and a badge. And unfortunately, that may not be the best approach for somebody who's having a mental health crisis. So thank you to Todd and his team for doing that. But again, this job is not complete yet. So there is still a lot of things that there's room for improvement. For example, and again, I'll let Todd speak more about that. There is not a 24-hour service for mobile crisis. So if somebody's having a mental health crisis, at 1 in the morning, the people that will be responding will be police officers. So we still need to continue working on that. And that is gonna segue into my next pillar, which is pillar number 5, training and education. I'm very proud to report that San Rafael Police has nearly all of our officers are CIT trained. CIT stands for Crisis Intervention Training, a 3-day training that's held at the Marin Sheriff's Office. It helps us deal with people that are in crisis, and we're very lucky because a lot of other agencies in California, not all their officers get this training. So it's something that we in San Rafael strive to do and make sure that we continue to provide that training, so our officers are trained to deal with any crisis, whether it's 1 in the afternoon or 1 in the morning. So we will continue to do that. We also do the bias-based policing training, and I'm one of the instructors, and that's to acknowledge some of the systems that have been in place in this country for a long time. One of the things that I like to tell my officers is that perhaps I wasn't, or anybody from the San Rafael Police Department was in the South in the middle of the civil rights struggle, but there were guys with a gun and a badge, and so that legacy carries to what we have here today. So it's important to acknowledge that. It's important not to minimize it, and it's important that people continue to train and remember that, because when you deal with a member from the Black community or the Latino immigrant community, their experience is going to be vastly different from other people that were born here in the United States, people that grew up in Marin County. So, experiences are going to be very different. So, let's see, I think that's going to bring me to pillar number 6, and the last one, which is the officer wellness and safety. And that is mostly an internal thing, but it's also important to acknowledge the sustained trauma that officers respond to, or officers sustain as they respond to multiple calls. And it's not an excuse, it's not a, trying to excuse any rude behavior or anything like that, but it's definitely an acknowledgement that, officers do see people at their worst. And if we don't deal with it by, like, for example, at the police department, at our new public safety center, we have a gym that allows us to work out and, get some of that anxiety and stress out by working out. So those are some of the things that are very important to continue through. So, so those are the 6 pillars, and that's what we do in San Rafael to deal with them. I also want to, how are we doing on time here? I also want to talk about some of the other things that we do to reimagine public safety. I mentioned Todd's team, and I mentioned the CIT training for our officers, but we also have other approaches that are not so traditional. For example, we also have a mental health liaison, Lynn Murphy, who's a trained MFT who works for the police department. Now, she's not a sworn officer, so she doesn't carry a gun or a badge or anything like that, but she works with us, and she does some crisis management. She also does some long-term care and some case management for some of the people that we deal with often. So it's a different approach from just having an officer issue citations or do anything like that. So I think it's important to, acknowledge some of the different partners that we have here. And last but not least, I also want to talk about our ongoing collaboration with the District Attorney's Office. I know Lori is here, and one of the things that we want to collaborate now is with the gun safety. Our country is going through a huge crisis of gun violence. I mean, here in San Rafael, we just had a homicide, with a gun last week. So the problem is here, and we need to deal with it. So some of the things that we'll be working on, we provide free gun locks for anybody who wants a gun lock. They can come to the police department, safety center during business hours and get a free lock, no questions asked. We'll give you more than one too. So we want to make sure that the guns are safe and they don't get in the hands of children or they don't get stolen. And we'll be collaborating with the DA's office in future endeavors to make sure that we deal with gun safety. I think with that, I'm gonna not hug the spotlight and let my friend Pierre join in. So thank you for listening.
You ready for me, Monica? All right. Hello, everyone. Good to see you. See some familiar faces out there. I'm just going to cover some of the outreach that we do with the community throughout the county. I won't get too much into my background, but just a little tidbit about the sheriff's office in case you're unfamiliar with it. We have 4 different stations in Lucas Valley and San Rafael. We have a station down in Kentfield on the College Marin campus. We have a station in Southern Marin and Marin City. And we have a station in Point Reyes. And so each station is kind of responsible for outreach for the most part in their respective areas of responsibility. So some of the outreach that we do, and I'm constantly telling people that all we're hoping for is opportunities to engage with the public. And so whatever opportunities we can create, whatever venues we can look for to engage with the public and build trust is something that we're constantly doing. And so some of those things that we do, and Raul touched on what they do in San Rafael, and we do some very similar things. Our youth academy is something that we organize with the assistance of Greg Davidson at Tam High School. We do outreach through Marin County Office of Education in English and Spanish. And primarily the program is designed to educate children what the Sheriff's Office does and exposes them to a variety of our divisions and kind of starts building relationships with the youth, which I think is really the key point in that program in itself. Camp Kuga now, as Raul mentioned, is something that we take part in. It's an annual event. One thing I will say is, obviously this past year with the pandemic, a lot of these things that we typically do, we haven't been able to do for over a year now. And so, but things are looking better. We're hoping that we get to the yellow tier next week, maybe Tuesday. So we're starting to look at doing some of these things again. Beginning back to Camp Chance, kids 11 to 13 years old. It's in its 21st year. The staff that we send out there are typically people who volunteer their own time to spend time with the kids. And that's a week-long program that those kids are primarily chosen through the counselors in the schools, and that's done working closely with the school resource officers in our communities. National Night Out is another thing Raul mentioned. It's it occurs the first Tuesday in every August. So we're looking to do that again this year. And that's something where we just go out to a variety of communities and kind of set up, refreshments, food, that kind of thing. And it's just a way for us to get out and meet the community in their own neighborhoods and just have conversations and talk about whatever topics the communities want to talk about, and just kind of break down those walls by creating those opportunities. Something like a little bit out of what we do in the community, but I think it's really important, is our reentry team in the jail that we have when people are getting ready to be released from jail, especially if they've been there long term. Our reentry team is very highly regarded nationally as having been very successful. And it consists of two deputies and a bilingual program manager who work closely with the inmates in the jail and help them transition back into the community. That's working very closely with probation and health and human services as well. It's kind of a multidisciplinary approach to getting people back onto their feet. And I know that maybe this group is looking for how we target mostly the Latino community, but everything I'm talking about is kind of we're trying to reach everyone. And so, but that certainly helps a variety of communities within the county, and it's been very, very successful. Some of the outreach we do is in the form of support, whether it's a monetary support like the Canal Alliance, which you're all probably familiar with. The sheriff contributes financially to the scholarship program every year. The sheriff also contributes to Bridge the Gap. If you're not familiar with that, that's kind of like a college prep program down here in Southern Marin. And it's mostly high school age students, provides tutoring, counseling, that kind of thing. They have an office at Tam High. And then we have one of their offices here in Marin City on Drake Avenue. And I looked at some stats there. They primarily serve youth of color, come from a variety of ethnic, cultural, and religious backgrounds. Their student population is approximately 44% African-American, 30% Hispanic, 16% multiracial, et cetera. So they are mostly targeting the underserved communities. That's what they do. Coffee with a Cop, as Raul mentioned, is something that we are starting to do again. As a matter of fact, tomorrow morning, Monica had inquired about West Marin outreach that we're doing. Tomorrow morning in Point Reyes at Toby's Feed Barn at 8 o'clock in the morning, we're doing Coffee with a Cop. Lastly, I want to put in a plug for my search and rescue team. It's about 90 volunteers and about 30 to 35 youth members. It's a very high functioning, highly trained team, very well regarded. They travel throughout the state performing search and rescues. And I mention that because we've done a lot of outreach to the schools. We want to add diversity to the team to better serve the community. And that hasn't always been an easy thing to do because they're associated with the sheriff's office. But if any of you know anyone that might be interested, the youth members we take are primarily freshmen and sophomores. We try to, after they're trained, we try to get a couple years of service out of them before they go off to college if they choose to do that. So please email me. Monica has my email if you know anyone interested in the SAR team. One of the concerns was the equipment cost for search and rescue, and we have a fund set aside to buy equipment for those that can't afford it to be a part of that team. All of these things that I talked about so far that we do outreach on, or we primarily message that or advertise that through social media. We use platforms like Facebook, Instagram, Twitter, and Nextdoor. And so if people aren't on any of those platforms, a lot of these things that we do, they'll never be heard about. And so I always try to urge people to get onto those things. And while I have your ear, if you live in the county, alertmarin.org is something that everyone should be signed up for. It's kind of our emergency messaging system for evacuations and that sort of thing. And because I want to ask specifically about West Marin, I wanted to kind of pass on something that the county does out there is a couple of important programs that aren't necessarily sponsored or supported by the sheriff's office, but certainly we are involved with them, and they are resources that we send people to. And one of them is the West Marin Multi-Services Center. They're kind of an information and referral service. Anyone can walk in, anyone can call. They have bilingual staff always available, and they're really good in regards to getting people signed up for Medi-Cal, CalFresh, which is a food assistance program. And specifically with CalFresh, if an adult does not qualify because of their immigration status, what have you, there is a good chance that their children do qualify, and sometimes that keeps people away. But that is definitely a great resource out there. And also CalWorks, employment assistance. They're at 331. They're on 4th Street in Point Reyes Station. And then the other one out there in West Marin is the West Marin Community Service Organization. And their core programs consist of a food pantry. There's 4 locations in West Marin where they provide food. I believe it's 1 day a week in each location. And that was San Geronimo Valley, Stinson or Bolinas. They go back and forth there, Point Reyes, and up in Tamales. They have a Latino engagement program, and they kind of function as a bridge between the immigrant population and the larger West Marin community. They focus on Latino leadership and engagement. The program is referred to as Abriendo Caminos. So for those of you interested in some West Marin programs, those 2 resources are out there. They also provide emergency assistance and case management, translation services, workshops. They run a thrift store out there as well. And when I was talking to one of the employees out there the other day, they told me a story of the thrift shop raising money for a family whose car broke down and they couldn't get their kids to school. And so they were able to get that car fixed so they could take their kids to school. So the resources are out there. They certainly could probably use more, but they are there for those that need them. So that can be passed along. I think that's pretty much what I wanted to cover as far as what we do for outreach and some of the resources that are out there. There's certainly more, but that I think kind of highlights what we're typically involved with. And like I said, the pandemic has really put a damper on things in this past year, especially with everything that's gone on. But things are getting better. At the end of the month here, we're going to be a part of I don't know if any of you are familiar with Uncomfortable Conversations with Black Men. It's a book written by Emmanuel Acho. We're actually doing it. There are 40 participants down here in Marin City with law enforcement and the community members. So once again, not directly related to the Latino community. However, it shows our willingness to go out and be a part of the community that we serve every day.
Thank you so much, Pierre, for sharing that and everything that your department is doing and is involved in. There's definitely more you can share later on in the Q&A, but thank you. Thank you, Raul, as well for sharing. Really appreciate it. And now we will pass it on to Todd.
Thank you, everybody. Let's see here. Hopefully this will work. I'm going to try to do a screen share here. It's been an adjustment for everybody this past year. So let's see, hopefully this will work. And let me just start my slideshow. Can everybody see that?
No,
all right.
not yet.
No?
Not yet. Nope.
Okay. You know what? I think at this point, since I'm technologically challenged, I'm just going to use it as a basis of me talking. Thank you for your adaptation with me. So I wanted to talk a little bit today about our mobile crisis continuum. It is run and funded and authorized and operated by the Marin County Behavioral Health and Recovery Services, which is a part of County Health and Human Services Department. The mobile crisis team, we started about 6 years ago. We got a grant through the state, through CHAFA, which is the California Health Facilities Financing Authority. And that allowed us to pilot a mobile crisis team. At that time, the funding allowed us to have basically be open from 1 p.m. to 9 p.m. About a year ago, actually about a year and a half ago, we were able to apply for further funding through CHAFA, specifically focused on access to youth. And one of the things that we got a lot of feedback on early on when we were opening up the program from schools and so forth were that great program, love it, but a lot of our youth have crisis during the mornings. We'd really wish that your service was open, in expanded hours, particularly in the morning hours. And so this grant actually allowed us to expand our hours. And now our current hours are Monday through Friday, 8 a.m. to 9 p.m. and then Saturdays from 1 p.m. to 9 p.m. Our team is located at 250 Bon Air. which is at Marin Health Medical Center. It's on the county's behavioral health building that's located on campus. They're located right next to our crisis stabilization unit, which is the main evaluation center in Marin County. Our team members, the members of the mobile crisis team, are all mental health clinicians. They're all licensed or licensed eligible clinicians. They respond to the community in pairs, unless, of course, we're having some staffing challenges that day, which do happen. Anybody can call mobile crisis, and I'm going to be passing off flyers in English, Spanish, Vietnamese, with all of our contact numbers and everything. So, so that you all have that for the community. And who we serve anybody. You're a human being in Marin County experiencing a behavioral health crisis, whether you're a resident, you're a visitor, you're just passing through. We have the potential, and there's no exclusion in terms of us responding to your situation. This service is free. It's free to the public. You don't get a bill. It's payer source blind. We don't ask you if you have insurance, what your insurance is, et cetera, nor is our ability to respond to you. I've got assistance from Connor. By the way, I did want to introduce also Connor Pierce, who's our brand new unit supervisor, and he literally has just started with us here in the last 3.5 weeks, and is going to be increasingly taking leadership around the program. So we're really thrilled to have Connor with us. Connor comes to us from a different county where he was a supervisor in child welfare and has a lot of children's background that he brings to our service, as well as supervisory experience. Our objective, the objective of our service, is to provide an alternative to law enforcement response for people experiencing behavioral health crisis. We see ourselves as being part of reimagining public safety. We intervene utilizing a therapeutic approach, and we can spend additional time with somebody trying to de-escalate the crisis in a least restrictive manner as possible. And then we also have the ability to do some follow-ups with folks. So sometimes, a crisis situation can kind of get de-escalated in the moment, but it's still very fragile. And sometimes we'll do a follow-up the next day, or even a few times if necessary. And the whole goal is to provide the least restrictive intervention, utilizing all the different things that we do. And then if indicated as a last resort, we are authorized, much in the way that peace officers are authorized, to place people on what's called a Welfare Institution 5150. For youth, it's called Welfare Institution 5585, which is essentially a civil, I want to really make emphasis on that, civil, non-criminal, involuntary detention for further evaluation if a person is deemed at risk of harming themselves, harming others, or being unable to meet their basic necessities of living, food, clothing, or shelter, due to a psychiatric impairment. Next slide, if you could. All right. So there are some, how do you call it, limitations or challenges with our service. For instance, we can't guarantee, I would say that about 80% of our calls do not involve law enforcement, but that means that about 20% of our calls do. And we partner with law enforcement agencies there are 13 law enforcement agencies in Marin County, and we partner with all of them, depending on where the crisis situation is happening. Our first goal is to see if we can handle the crisis situation ourselves. But there are some situations where if an assault's in process, an active suicide attempt is happening, there's destruction of property currently happening, threats to harm others, or likelihood to be physically uncooperative if that became necessary, then we do partner with law enforcement. So I'd say, again, 80% of our interventions don't involve law enforcement, but 20% do. And I put that out there in terms of community expectation that there'll always be probably a partnership with law enforcement. As a matter of fact, I noticed our Santa Rosa partners on here, and they mentioned the cahoots model, and which is fantastic out of Eugene, Oregon. Been doing it since the 70s. A couple of hippies started it, God bless them, and now is seen as kind of a national model for this national movement around reimagining public safety that is happening. But even they occasionally partner with law enforcement when they need to. So so some of the challenges that we have one team of 2 clinicians in the field to respond countywide currently, everywhere from Sausalito to West Marin to Northeast Nevada, Tiburon, Fairfax. So obviously we can't get to everything at all times, and calls for service are prioritized based on what the acuity of the situation is and what the risk level of the situation is, and not necessarily when the call was received. So we reprioritize based on kind of what's called acuity risk. So sometimes we may not be able to get to all the calls in the course of a day. And the average time of a field-based call for service for us is about 2 hours. It could be lower than that, it could be longer than that. We do make every effort to answer calls for service. However, sometimes it's not possible. And so if you go to the voicemail, please leave a detailed message. And as soon as a clinician's available, they're going to be returning that phone call. But of course, if the call is so urgent and it can't wait for us to get back to you, then we do direct people to call 911. All right. Are you able to, yeah, okay, thank you so much. So let's see, just a little bit. I did want to just very briefly, I wanted to tell you also about our transition outreach team, which is our kind of our follow-up linkage case management team for people who are not hooked up to traditional behavioral health services, or they're falling through cracks in crisis, or maybe their Medi-Cal ran out and they never renewed it, and that's a part of the whole thing that's causing stressors and so forth. This team can kind of be, is sort of a follow-up team, and it consists of our clinicians as well as peer providers who are people with lived experience who provide support, wellness recovery action planning, and embody hope and recovery in mental wellness going forward. As a matter of fact, we have an opening on that team for a bilingual peer provider, and I'm going to be sending that information out, hopefully to use with your networks, because we have openings. We also have openings on our on the clinical side as well that I'm going to be sending out, including an opening that's going to be happening on the mobile crisis team. And we're extremely interested in bringing somebody on who is bilingual and bicultural. We can do a better job, and we're committed to do a better job with outreaching to all of the communities here in Marin County. So with that, I want to thank you so much for allowing me to present the program. I'll just also say a little bit, just a little bit more about the future. As you know, it is a very hot topic right now in the context of reimagining public safety. There's a national bill, I think a national bill with funding that's going through, that's going to create what's called, I think, a 988 system, which is going to kind of be parallel to 911, but more around kind of behavioral health and nonviolent public safety situations and so forth, with reimagining a whole kind of different dispatch system. There's so much that's coming in the next couple of years, including the county is in conversations with local city leaders here around potentially expanding our team and to have us on Saturday, and to also start to bring in a little bit of a mini cahoots model where we'll also have community support workers on the team, potentially a nurse, and potentially substance use interventionists. Thank you so much.
Thank you so much, Todd, for your presentation. think it's amazing that the county has gone forward with this, new initiative, the mobile crisis team, and really excited to hear about it. And also, I'm glad that you guys are opening up this position for a bilingual clinician. It's definitely important to be able to reach out to more in the community. And I'm really excited to hear about this new bill that you talked about, the Bill 988. And so, thank you. So now we're gonna open it up to questions. And so I know that we already have a couple that have been coming in. And so if everyone else wants to either type them in the chat or you can do the virtual hand raise, either way. So Saga's going to be helping me read out some of the questions. So I'm going to read the first one. And this is from Mayor Kay Collin. Again, she's mayor for the city of San Rafael. And her question is, I understand one of the key challenges to implement a CAHOOTS type of program is how the call is directed when it comes into the law enforcement. Oh, and this question is for Todd, by the way. Could you speak to how that could work here? And it seems that with such a lean staff, it will be difficult to respond promptly to the immediate crisis situation. We are grateful this program is in place and want to help make it as effective as possible.
Yeah. Thank you so much, Mayor Kate, for the question. Good to see you again. There's definitely there's a challenge with that. Now, one of the things that I think we are talking about implementing, even on the relatively short-term horizon, in our expansion as the county is talking to city leaders, is potentially we're trying to figure out how we can make sure that we have an OD person in our unit, or kind of a dispatch person, if you will, in our unit who's always available to answer the call. So that's actually one of the things that we're trying to build in the short term. In the long term, I think there's going to be, I think that's what this sort of 988 model has sort of contemplated, and how that gets manifested here in Marin County and or regionally is still to be determined.
Okay, thank you. And so the next question will come from Stephanie Hellman, and she's the vice mayor for the town of Fairfax. So go ahead, Stephanie.
Hi there, can you hear me?
Yeah.
Thank you to all the speakers, it's been really wonderful. Todd, this is also for you. So we are entering our fiscal planning cycle, as you probably know. So with regard to staffing, do you know like what it would take from a funding perspective to support a 24/7 operation that supports Marin County wide?
Well, it depends on sort of the nature of what you're rolling out. So if it was just like the current construct of the model that we have over a 24-hour period, we probably have a budget for that. I don't have it off the top of my head, and I could probably get that to you. Mm-hmm. But if we were talking more about maybe expanding, regionally, for instance, like one, early proposal was to have sort of 3 regional teams, and then potentially to have a one team for the county for an overnight. That would be sort of a different budget projection. So, probably the more realistic, which is the former. I could reach out, and I'm happy to share a potential budget projection on that.
Okay, that would be terrific. And do you have statistics regionally on, call volume or incident volume, so you can understand the distribution of need across the county?
I'm so sorry, I was having a hard time hearing you, but I think what you were asking was if we have stats on what our call volume is. And if that was correct, that yeah, we do. We have data going back to the beginning of the program in terms of our, how many individual contacts we have, how many frequency of service to individual folks and so forth. We have some data on that, yes.
Thank you so much.
Great, thank you. So then we have a question from Aaron Alarcon, and then after will be Tammy Taylor. So go ahead, Aaron.
Yes, thank you. I need to talk about something that needs to be brought up. We all know the social unrest across the country related to the multiple killings of men of color, particularly Black men, by police departments all over the United States. This has created a movement of defunding the police. The people behind this movement of defunding the police do not believe that it's just about a couple of bad apples. They believe that the police system, along with our criminal justice system, is completely broken and needs to be completely redone. In fact, this morning I read about this Black man who in 1978 was sentenced to, I think, 40 years or something like that. And now the prosecutor realized that he was innocent. And cases like that happen all the time. Among the reasons to defund the police, the advocates of this movement claim that the policing in the US was established to maintain white supremacy as part of the US slave patrols and night watches. A lot of them believe that police doesn't keep us safe, considering that despite the billions of dollars spent every year on policing, more than 15,000 people were killed by gun violence in 2019 alone. They say cameras, training, and the so-called reforms will not end the cycle of police violence. They also claim that policing diverts billions of dollars from schools, healthcare, and other vital programs that need more funding to strengthen our communities and support shared values. In summary, Black organizers are calling for divestment from policing and investment in human needs across the country, as our tax dollars should be invested in humane and just alternatives to policing. I happen to agree with these points by many advocates and activists in our community and our nation. As police officers, as part of this apparatus that has been oppressive, particularly to people like me, what do you have to say?
Well, I like to say, I hear you. I understand the situation, and I too, I have also been oppressed before. I wasn't always a police officer. I have had to, stand in front of an immigration adjudication officer and, see if I was going to be able to stay in this country or had to go back to Mexico. So I've been through some of those things, and I have been also stopped for something that I think was just the color of my skin. So I hear you, I understand you. I do not minimize your feelings or the feelings of the activists that are out there. But we are, like I said at the beginning of my presentation, we understand we had to do better, and we will continue to do better each and every day because, like I said earlier, I stand for, compassion, dignity, and justice. So, when people commit crimes, we will investigate those crimes. And, when people don't commit crimes, we'll engage with them and we'll try to be the best public servants we can be. So that's what I had to say to you, Mr. Alarcon.
Thank you.
Any other officer wants to chime in? If not, we can continue with the next question.
I would just say that Mr. Alarcon brought up quite a few points that are all very complex in their own right. Trying to lump everything together is although it's, they're all emotional points here, but breaking up these injustices, breaking up and dissecting individual experiences is important. We can't paint a profession with the same brush, the same way we can paint a race with the same brush. So there's a lot of work that needs to be done. This is very complicated. And I would just like to end it by saying that just because someone wears a badge for a living and that's their profession does not make them a bad person or racist. I think things are changing for the better, and I think they will continue to go that way because in the end, we are a service provider for a community. We need to respond to the community's needs and to the community's wishes. That's why we're here. So as we make our way in that direction, I think things will only get better. Nothing's going to happen overnight for sure. This is something that will take time to evolve.
Thank you. Mr. Alarcón, do you have a follow-up question?
Well, just a comment, not necessarily question. The points that I brought, Officer Ahuncain, are not emotional, are actually based on facts. And Sergeant Aguirre, I hear you. I don't agree with you the way you handled your the instances that you were discriminated. If I'm oppressed, I'm not going to join my oppressor, but that's my personal take. Thank you for the opportunity to speak up.
Thank you. And we have a question from Tammy Taylor.
Yeah, thank you. And thank you to the officers who've already commented about what's being done. It's interesting to hear about all of that. I had a question more about, when it comes to building trust in communities, especially communities of color. One thing that happened in 2020, which it was really sad to see happening throughout the country, were protests, civil protests. And one of the things that I noticed happening a lot, and I'm not saying this happened here, but some of the things that were happening were quelling of the protests using nerve agents like, tear gas and things like that. And I understand that some of the police departments in Marin County also have some of those tools at their disposal. My concern is in building trust with the communities, having a militarization type of format for handling when crowd control, when things get out of control, doesn't always help for building trust. And I guess my question for the police officers is are the policy changes coming around that, if that is still in place for handling when things, escalate? I understand de-escalation techniques, you want to have, tools at your disposal, but at the same time, like I said, when we're trying to think about building trust in communities like this, it would just be nice to know if there are some shifts happening on that field as well. So I was just wondering if the officers could speak to that, please.
I can speak to a little bit of locally and a little outside of our county as well. There may be some agencies that have tear gas in the county for crowd control purposes. We are not one of them. Thankfully, we've never had to request it or use it. And I can't say, that locally the protests that we've actually been a part of and worked closely with here, particularly in Marin City where I work, we were there in a supportive role. We were providing water, traffic control. I worked closely with the organizers. It was, we're a part of this community down here, and so we approached it that way. As a matter of fact, I think any I don't know, discontent wasn't really voiced from the local residents. It was from people outside the area in Mill Valley and Tehran and such that would show up. Having put together law enforcement groups to respond to places like Oakland, we can avoid putting our local assets on the front lines, whether anywhere near any gas deployment or anything like that. I request specific missions to protect either command posts or parking lots or that things of that nature. Because once again, we don't use gas in this county, and so it's not something that I think we're going to look at using in the future either. As far as building trust, I think some of the protests you're referring to are perhaps Oakland and some areas like that. It's really hard to compare our county with another county or another city. Things are very different. I think we have a very good working relationship with communities here in this county. We haven't had to face something like that. And I can't imagine, working closely with those folks in Alameda County. It's a difficult situation. It's one of the where you have a very small minority group of protesters who are causing the majority of the issues, whether they're damaged or whether they're violent, and trying to address those individuals and not treat the whole as those individuals are acting. So it's tough. It really is. But I think for the most part, what we do in this county is kind of setting the standard. I think we're ahead of the game, and I think that's fortunate. And part of that is because of the makeup of our communities. We're, I think, a fairly peaceful county, and we haven't attracted protests like that. And so I think we've been a little fortunate. I don't know if that answered your question.
I can add that just like Lieutenant Ahuncain said, we don't use any of that equipment. We don't have it. I mean, San Rafael, it's a small department compared to some of these other departments like Oakland and, San Francisco or whatever. So, we don't have any, military grade equipment or anything like that. So, I think it's important to remember what I made a remark that, there's 18,000 police departments in the United States, and, they're going to be all over, it varies widely. And a lot of times the stuff that comes up in the news are just, the larger departments or out of state. So I think we're very lucky, very privileged here in Marin County that we haven't had to deal with any of that stuff. And we just don't have the equipment. We proactively reach out to the community members who, might be staging a protest or anything like that to see how we can help. There were protests last year, and, our chief of police then marched with the protesters. So, we understand the situation. And we just want to help, that First Amendment right, and just, we're here to serve at the end of the day. So.
Thank you. Yeah, that answers my question.
Thank you, officers, for answering that. So our next question is from Heather Johnson, and she works at Huckleberry Youth Programs. And, the officers, and Todd can also chime into this one. Is there any move to change the requirement to handcuff youth when police assist with transfer of youth from school site to crisis stabilization unit versus going in back of caged car if mobile crisis responds? This perpetuates the stigma of mental health and escalates most situations.
I'm not aware of any changes coming forward. Obviously, that's not something that an officer or a deputy enjoys doing. I think a lot of it really is based on liability. If you have someone who is a danger to others or danger to themselves, what is the risk that we take by not securing them? But I totally agree. Handcuffing someone does perpetuate a stigma that, that mental health, that, people in crisis, it can escalate a situation. People, when they get handcuffs, are sometimes resistive, and I wish I had an easy answer for that. I think it's kind of one of those things where it doesn't look good, it doesn't feel good, it doesn't, it maybe not entirely appropriate. But on the other hand, if you look at all the policies of the departments, I think most are going to say to handcuff anyone that you're transporting in the back of your car. And maybe Raul can speak to this too. I'm pretty sure that all the policies are pretty much the same across the board. And I think it's just based on liability, unfortunately.
But I'm curious why Todd's liability is different than yours.
That's a good question.
Well, one thing I could say, one thing I can say though is, in fairness, is so if we're involved with youth, adult, doesn't matter, because we deal with all parts of the life cycle. We're only gonna, so we're gonna engage, we definitely wanna, first off, we always go to the least restrictive alternative, right? So if we can deal with something and they don't have to come to the crisis stabilization unit, that's always our first move, right? Now, if we engage with a youth, adult, anybody, and we've got a working relationship with them where they're cooperative with us and they're willing to work with us and willing to come down, then yes, that's kind of part of the value that we bring to the table, is that we're gonna provide a non sort of law enforcement transport up. We don't we can't secure the car. We do have a little bit of a security in the car in the sense that you can't open the door like, I changed my mind, I'm now gonna open the door and get out of here. But because we've deemed you to be kind of cooperative enough, there's no requirement to be in a handcuff situation. But if we deem you that you're at risk and that there's a potential safety element, then guess what? As I said earlier, we're still going to partner with law enforcement.
Absolutely, as one would. I totally agree. Yeah, absolutely. But I'm saying like there is somewhere in between there.
Yeah, agreed.
If they're sitting with a group of people and they're stable and they're willing to go that next phase, we're going to destabilize them by, and the only issue is transportation, and you guys, because of your transportation issues, aren't able to respond.
Mm-hmm.
Then we are stuck with a transportation issue.
Totally. You're 100% correct and valid.
So I like to just add that, the members of the San Rafael Police Department, just like Todd mentioned, we try to take the least restrictive mode, especially with a juvenile, somebody who's underage. We'll always try to see if the parent is able to do the transfer or whatever the parent's needs and the family needs are. So that is the preferred method. So, I think it's very far and few in between when we actually put handcuffs on a juvenile. So, I think we definitely we do a good job to try to de-escalate, try to stabilize the situation. And once, it's the proper amount, we've gone to calls where, we de-escalate the situation, and then the parent's able just to take the child to their regular mental health provider or mental health crisis in their personal home vehicle, and we don't have to touch, put hands or transfer anybody. So definitely always try to least restrictive mode.
Thank you. And so I have a question, and this could go for either of the officers. You mentioned that you have, the Camp Chance. I think you said there's a new name for that. And that's mostly you recruit students through the school resource officer. But I know that there are some schools that have cut ties with school resource officers. And so do those schools still have the opportunity to recommend some of their students, even if they cut ties or just don't even have a school resource officer in general?
Well, I can speak a little bit about that. Since obviously the pandemic forced us to cancel last year's Camp Kuga, we really didn't have, we don't have a clear answer on that. Obviously the camp is to, provide children that otherwise wouldn't be able to attend a camp. I personally went to the camp a long time ago, several years ago. I went to the camp, spent the night there, did arts and crafts, played soccer, football, with the kids, and it was a great time. And interacting with the kids, a lot of them, this was the only camp that they ever went to. So it would be a loss if the children would not be able to experience, a summer camp. I mean, what an amazing, event, horse riding, going to the ocean, all kinds of things. So it would be a shame, that some kids miss out on that. Now, we didn't have it last year because of the pandemic. We're not having it this year because of the pandemic. I think we're going to continue working with other community partners to make sure children can go to camp, because, I think it's a good event for the children, but I really can't answer because of the the COVID events. So, LT, you have anything else there, maybe?
Yeah, just in the past, the outreach for Camp Chance is primarily done through school counselors. They kind of like pick and choose the kids that they feel would benefit the most, and then they work with a school resource officer. So we rely on the school counselors primarily.
Okay.
I do have a question for Todd. I've worked with Marin and its Latino community for a long time, and I know it's very challenging to get the word out whenever there is some type of help, especially I'm talking more like the canal. So for your resources that you provide, how are you getting that information to like the people of Canal when they need someone like you or your program to help them out in a crisis moment?
Probably not well. And that's part of my efforts to redouble on that. We actually, I believe Connor and one of our clinicians, one of our bilingual clinicians, actually met with direct service providers yesterday in the Canal Alliance and presented on the program. We have outreached a few times over the years, but yeah, no, anything. I'm basically open to suggestions, businesses, anything we can do to improve that, because I think we do need to improve it.
Great, thank you. And I think, I don't know, connecting, and maybe you have already a Canal Alliance programs that really reach out to the Canal community, just because I have myself worked with students from Canal, and I know that just getting the information to the parents in Spanish, it's very difficult, it's challenging because it's such a culture, and it's so tight in that community. So yes, I 100% agree that there should be more going out there and letting them know about the services that you provide.
Yeah, and it's a big initiative on our part. One thing that recently we just have brought on, and I mean we just brought on, and it's I always talk about I'm kind of like a singles hitter. I hit singles sometimes, and all of a sudden you score runs and you win a game. But you got to start somewhere. You got to hit some singles. And one single I think that we've hit recently is that we're actually able to, we just contracted with our language line services for video translation. And not only video translation, but video translation in the field, in the moment, when we need it, on the spot, crisis. And for in terms of Spanish, which is our threshold language here in Marin County, 24/7 video translation on the spot.
Great, thank you.
And Todd, if I could jump in real quick, because I saw Sergeant Aguilar, you had commented about needing bilingual staff. That is, and I know Todd had mentioned it earlier, a major need here. So even in the presentation that we did, I think it was yesterday, that had come up is how do we even connect with the community of Spanish-speaking folks. So I did put a comment in the chat. I'm pointing over here toward where the chat is on my screen. If anybody is interested, so what I've been doing, kind of my own little project here, is gathering folks who I can, as jobs come available, put out an email to help us get applicants in the door for the different positions that we have who could be bilingual. So I'll copy and paste it one more time, but I just wanted to throw that out there for anybody who's interested. Please email me, and I'll start getting the word out through you guys as well.
Question for Sergeant Aguilar, and before I ask the question, Pierre did mention the National Night Out, and a couple of years ago, I joined you guys, Sheriff Department and Police Department at the Canal at the Pickleweed Park, and that was a really nice family event. So thank you for doing that. Hopefully we can do something this August. If not, there's always next year. But I wanted to ask you, Sergeant Aguilar, building trust, you guys indeed, the Citizens Police Academy a couple of years ago in Spanish and English, of course. And I recall about 25 community members participated on this Spanish version of it. And that was a really, I thought, really great venue to connect with the Hispanic Latino community. Is there a possibility to maybe do that again in 2022?
Yes, absolutely. We're still, we do wanna, we have big plans for once the pandemic is over. We do wanna have another Spanish language Citizens Academy, and also a youth academy. So we're still kind of working on that. You know, we have the staff, you know, we have multiple officers that are Spanish speakers. So we are very eager to do that. And we're just waiting for, you know, some of the indoor restrictions, the gatherings. So we'll definitely, please stay tuned, you know, follow us on social media, and we'll put out the information there as soon as possible, as soon as that's available. But we definitely look forward to doing that in 2022 and beyond.
Thank you. Thank you.
Thank you.
All right, so I do want to be aware of time. We have about 5 minutes left. If anyone has one last question or anything to bring up or share at the same time.
This is Rafael Rivera with the City of Santa Rosa, and I was very pleased with the presentation and the panelists. I think it's a great step in the right direction, especially during these difficult times. So I commend you for your work. And I know that some of my colleagues are on the call. So this was a great presentation. So I really thank the Marin Latino leaders. And I wanted to also personally say hello to Yolanda Gibson, who I've known for a very long time with engagement projects throughout the community of Marin. Thank you.
Thank you, Rafael. All right.
Hi, everyone. My name is Jenny Vanegas Lacey. I'm one of the mental health clinicians with the Access team, which is the County of Marin. We are one of the main entry points to connection to mental health and substance use services. And we have a bilingual, bicultural, Spanish-speaking team. All staff except for one only speaks English, and the rest of us speak Spanish and English. I just wanted to provide the Access team contact information. So for folks that want to refer any person, any age, primarily, so a couple of things to keep in mind are that they are Marin County residents, that they either have Medi-Cal, and it could be combined with Medi-Cal and Medicare combined, or just straight Medi-Cal, and that, or they could be low income and uninsured. And just to note, we're not requesting any kind of proof of documentation status or residency status in regard to immigration type concerns. So if someone is low income and again, uninsured for whatever reason, they you can direct them to the Access team. Our line, the 888 number, is a 24-hour line. It's not crisis. I just want to distinguish that it's different from the crisis unit and the mobile crisis team, but it is a 24-hour line. How I recommend that folks call during normal business hours because that's when the Access team staff are present and are taking incoming calls. And then the after hours, that we have a call center. So they're obtaining information, making sure someone's not in crisis. And if they are, connecting them to the crisis unit or other services. But the real figuring out of what next and what they're looking for really happens primarily during the normal business hours. If someone calls and we do not get to pick up the line in time to make that direct contact, please have folks leave us a voice message. In whatever language, it doesn't matter. Leave a voice message and we will follow back up with that person. That's super important because we want to do that outreach, and that's a big thing for us. So just wanted to touch base, provide that information, just as a kind of a follow-up to in regards to kind of mental health services and connection.
Great, thank you, Jenny. We are saving, if you post any information on the chat, we are saving the chat, and we can forward you all the information and numbers that they are putting on there. So if you're not taking notes, we are taking notes for you. So we do have about 2 minutes left, and I do want to thank Sergeant Raul, Lieutenant Pierre, Connor Pierce, and Todd for being able to have this conversation, because it is important for the community to know kind of what's going on with the police department, but at the same time, how can we also help when we don't need the police, like, right? Who do we need to bring? And Todd, thank you so much for bringing up your program, and hopefully as we spread the word in the community, we're able to use it if we need to. And I know that Monica, you wanted to say something.
Yeah, there's a question here about any follow-up luncheons about, regarding law enforcement. And yeah, we definitely do plan on having future events. I have been in contact with the president of the NLPOA, which is a National Latino Peace Officers Association, and we're trying to get something together regarding, further community outreach and also careers in law enforcement for Latinos. And then we also plan to hold a future Marin County Sheriff's Forum that'll come later this year. So you guys could hear more about the two officers who are running for Marin County Sheriff. So yeah, if Saga, you want to go ahead and close us out. Thank you.
Yes, so again, like I was saying, thank you so much for having this conversation with us. For those that asked the questions and also provided your feedback, thank you so much. And hopefully this is a conversation that we're able to have in the future as we open the spaces to do so. So with all that said, thank you. Thank you to everyone that showed up. And we will be following up with a next luncheon with the date and everything. So be sure to check your emails or ask any questions to Hugo, Monica, myself, or Yolanda. So with that being said, thank you. Have a great rest of your day.